So one of the questions that we get here all the time at iHealthBrokers is, do I need Medicare Part D if I have a Medicare Advantage plan? And no, you don't. You may already be receiving Medicare Part D benefits with your Medicare Advantage plan, and if you're not, you can easily add it. Medicare Advantage plans work a little bit differently than original Medicare. That's because they actually replace original Medicare entirely. There are 5 main types of Medicare Advantage plans. There's health maintenance organizations, which are HMOs, preferred provider organizations, which are PPOs. Those are probably the ones that you're most familiar with. Then there's private fee-for-service, which is PFFS. There's special needs plan. Now this includes D-SNPs, which we focus on in another video. And then there's Medicare Medical Savings Accounts, also known as MSAs. Now each of these types of plans functions a little bit differently. They offer different benefits and at different price points, but they're all going to cover those basic benefits of original Medicare, which includes hospital coverage and outpatient insurance. Their main function is basically to provide those medically necessary services and limit your out-of-pocket costs doing so by working with a network of insured providers. It's really, really important that you understand that Medicare Advantage plans are not the same as original Medicare, and they're not the same as Medicare supplement plans. Now, this can be a great thing, or it can be a not so great thing. However, Medicare Advantage plans very often do offer additional benefits, things like dental, vision, hearing, and specifically for the purposes of this video, very often plans offer prescription drug coverage. Now, again, let me harp on the fact that I'm saying very often. Not all plans do offer prescription drug coverage, so it's very important that you understand what your needs are and the benefits that your plan is offering. Now let's say you've enrolled in a Medicare Advantage plan, but it doesn't offer prescription drug coverage, and that's something that's important to you. Well, you can purchase a plan that will offer prescription drug coverage. Additionally, let's say that your Advantage plan does offer prescription drug coverage, but it's really not suiting your needs. Well, you still have the option to supplement your prescription drug coverage that you're already receiving. Additionally, let's say that your Medicare Advantage plan does offer you prescription drug coverage, but perhaps the benefits are just not rich enough to support your needs. Well then, in this case, what you want to do is find a better plan that's going to support not only your basic healthcare needs, but also your prescription drug needs. There are a few things that are really important when you're choosing a Part D plan. One of the most important things is to identify the types of prescription drugs that you take and how much. Now you can compare these prescription drug prices on Medicare.gov, but as always, we recommend that you work with a broker. It's just much, much easier. But let's say that you take a specialty medication or medication that's a little bit more costly, then you may want to look at a more high coverage plan to limit your out-of-pocket costs when purchasing that medication. These type of plans are also helpful if you want to protect yourself from higher drug costs in the future. Let's say you're on the opposite end of the spectrum. What if you want to lower your monthly premiums, you want to lower that month-to-month cost? Well, you can absolutely do that. Just be aware that generally speaking, plans with a lower monthly premium are going to have a higher deductible or a higher cost share. Now, of course, as of 2021, the max deductible has been set by the federal government at $445, so it can't surpass that. But some plans, those enhanced plans, do offer to lower the deductible or waive it entirely. So basically, it's about understanding your needs and balancing it with your budget. If you want a higher monthly premium, you'll most likely have lower deductibles, lower cost shares. If you want a lower monthly premium, you'll most likely have a deductible that's on the higher end of the spectrum and probably higher cost shares. Really, really important with Medicare Advantage, we're not just talking about prescription drug coverage. There may be additional restrictions with Medicare Advantage as to the doctors that you can see and the hospitals that you can visit. So please make sure that those are also aligned with your healthcare needs. Medicare is wonderful because it offers you so many options to really customize your Medicare to your specific health needs. However, with a lot of options tends to come a lot of confusion, and making the wrong choice can really cost you. So it's important to tailor your coverage to your needs and to your budget. So first and foremost, you really need to understand and identify your needs, especially when we're talking about Medicare Advantage plans, because those plans aren't standardized like Medicare supplement plans. So you really need to shop around and make sure that the benefits align with your needs. The best way to do that is, of course, to use a broker. A broker is a third-party liaison who works for you, not the carrier, which is the insurance company. So you can have an honest conversation with your broker detailing your needs and your budget, and they can present you with several different options, different plans, and different carriers to find the option that's best suited, not only financially, but for your needs. So if you'd like our help, you can reach us here at iHealthBrokers at 888-410-0344. There is no charge for our services. We're licensed nationwide, and we really are the Medicare experts. And make sure to check out our YouTube channel for tons of other videos about Medicare and health insurance in general. Our goal is to make sure that our clients and our viewers are as informed as possible. Your health insurance is not something that you want to take risks with. And of course, please make sure to like this video. That way we can get this information out there in front of other people, and subscribe as well, because we do release these videos on a weekly basis. Now, if you have any questions whatsoever, feel free to give us a call here at iHealthBrokers, or you can just leave us a note in the comments below and we will absolutely do our best to help. Thanks so much. Have a great day.